Mr. and Mrs. Allen, how are you? I'm Dr. Peterson. It's nice to meet you.
Nice to meet you.
Good to meet you. How are you?
Good.
Hey, I really need that chair to get into. Do you mind if you have a seat over there for me?
Sure.
Okay, thanks. So,
What's wrong with him sitting in that chair?
well, oftentimes, it's the chair that I need to get to the computer so I can review your history. Remember all those films that you filled out? Forms that you filled out?
Okay.
Yeah.
Okay.
It's just, I don't see what the difference is, but that's fine.
So I looked earlier on, and it looks like you've got some erection problems or impotence.
He's having some, we're having some issues together.
I got that,
and
but I'm talking to him right now, if that's okay.
Yeah.
You mind if you put the cell phone down? I mean,
You should put the cell phone away. I've talked to you about that, and that drives me crazy. So I know it's going to drive other people crazy. Just
Okay.
put your cell phone away and
So-
listen to him. You promised
so
to
has
give me
anybody-
his attention. You promised me you would give him your attention. Please, for me, for us.
All right, I'm listening to him.
so has anybody tried you on any medicines for your erection problems before?
No.
Okay,
No.
no pills,
I've been
no
trying
shots?
to talk to him about it. This is his
No.
first time coming in to talk about it. He's been in denial about it. And he thinks it's me, and he's trying to accuse me
Well,
of being
a
the
lot-
one
a lot
having
of
the
people
issue.
have-
And it's not me, because I'm just saying. I mean, I'm not like all over town, but I'm not like naive, and it's not me, okay? So, I mean, it
Right.
took him, I had to drag him in here today.
So, I mean, is this something that you're interested in getting treatment for? Because there are therapies for this that are out there.
I don't know. You haven't told me about what any of these therapies are.
Well, we talked about the pills early on.
You mentioned pills. I don't know
Okay,
if we talked
yeah,
about
well,
anything.
You might need to like debrief him a little better because he's a CEO.
You know,
and he's used to
I'm-
people just laying it out there in a really organized
Okay.
way. And
Yeah.
I think you need to be
So-
a little more organized about how you present it to him, and then he'll absorb it.
Well,
I
you know-
promise. I will make sure that
Okay,
he
I see
absorbs
people
that.
with this
Are you
problem
listening?
all the time. So let me just talk to him a little bit. So
fine.
there are pills, there are injections, and then there's an operation where we can put a inflatable pump in the penis to help
Oh.
you with erections. Are you interested in any of those kind of things?
Maybe the pills would be better than the pump. I hope
maybe
it
the
doesn't make any
pills.
noise.
Yeah. So I mean, but you could have gotten the pills earlier, but you've never asked anybody about the pills
No, I've never had a problem before.
before.
Oh, that's not true. Don't look at me like that. I know what you might not be saying it, but I can tell in your eyes what you're saying, and that's not.
You know what
the
I'm doing?
cause.
Okay,
Can
so
you just tell
I'm,
him this
well,
is
hold
normal,
on. I'm
that
sensing
men
a
have
lot
this
of a lot of headbutting here, and
Mm-hmm.
I really think that you two have a lot to work out with before we can help you with this
Excuse
erection
me?
problems.
Wait, do I
Okay.
see a
So
psychiatrist?
well, I mean that might be in the future. So I'm going to let you two work this out, and we'll just
Great.
make another appointment when you guys are getting along a little bit
Are you
better to talk
serious?
about
That
this,
sounds
because this
great.
is a family issue.
I don't think that you
Okay.
approach this the right way.
I'm
It's
gonna
for me,
step
but-
right outside. I'll have the nurse come in and get your to-go
Are
paperwork.
you serious?
Okay.
You're walking
All
out right
thanks.
now? Can you believe are you walking out? He just walked out.
Hi, Mr. and Mrs. Allen. How are you? I'm Dr.
Hello.
Peterson.
Nice
to
to
meet
Nice to meet you. How are you?
We're not married.
Oh, I'm
Yet.
sorry. My fault.
Yet.
Sir, do you mind if I have that chair? I have to sometimes get to the computer while we do our interaction. Is that okay with you?
Yeah, sure.
Thanks.
That was his chair.
Well, it's very nice to meet both of you. Can you let me know what we can do for you today?
Well, I'll speak for us. We've been having a little problem, and it's affecting our relationship, and so we decided to come in and see what can be done.
So, what kind of problem are we talking about?
Well, we filled it out on the form. We talked about it on the form that they...
It's a functional problem.
Well, I read the forms before we came into the room, and it looks like there's some erectile dysfunction. It looks like it's been going on for several years.
Yeah.
And it's my understanding that at this point, you've never been under any therapy for erectile dysfunction. Is that correct?
Yeah, that's right.
Okay.
Well, I mean, and he, we've been trying to figure it out, and he thinks it's me, and it's not, because I'm not a 22-year-old girl anymore, a 20-year-old girl, whatever,
That's the truth.
and so I know it's not me, and I'm just trying to help him figure it out for us
Sure.
to figure it out for you
Well,
and for me. For
Well,
you
I can
too.
sense a little bit that this is really becoming an issue in your relationship. Is that correct? And you're moving forward with a marriage?
Yeah.
Yeah, it's an issue, definitely.
Okay. Well, I can tell you, by reviewing all of your medical records and your forms that you filled out for us, I saw that there's some diabetes and some high blood pressure there as well. And I can tell you that erectile dysfunction is a problem that happens in millions of men. And oftentimes it's secondary to other medical problems that are going on.
So you see, you're not the only one. There are other people that have this problem too, and they're even younger than you are. So it's not about your age.
Well, I don't want to take anything that's going to interfere with my diabetes medication.
Right. Well, the therapies range the options from everything to just a pill that you can take that typically do
Yeah.
not interact with a lot of
I've
stuff,
seen that on TV, yeah.
to injection therapy, to even a surgical therapy. And no matter what we need, there will be an end to this where I'm pretty sure that we'll be able to get you some sort of erection that will allow you to have enjoyable intercourse in the future.
Sounds good.
You're pretty sure about that?
When we go through these algorithms for treatments, we tend to be very successful with this therapy.
That's good. That's good news.
So is it something you'd like to discuss a little bit more?
Sure.
Okay. What kind of questions do you have right off the bat about erection medicines?
Well, do I have to take it all the time, or can we do some sort of one-time fix or something?
Yeah. If the pills work, oftentimes what you do is you take a simple pill just about an hour before intercourse,
Okay.
and that's oftentimes all people need. If the pills don't work, we can move on to different types of therapies, such as the ones I mentioned before, and then we can work together through this whole process.
That sounds good. See, it's easy. It's good.
Well, she'll be happy, so.
Okay.
Yeah, that'll be nice.